When we successfully intervene early and prevent a child from being sexually abused, not only is that individual child better off having never experienced abuse in the first place, but that's also one less child that needs CAC services and a civil and criminal justice response. This will help ensure resources are not stretched thin and that services are available for the children who need them. We can't address an issue unless we understand it. Child sexual abuse is a commonly misunderstood issue, and these misperceptions cause barriers to protecting children from harm. Many parents and caregivers already warn their children to be careful around strangers. However, in 90% of cases, child sexual abuse is committed by someone the child knows and trusts, and up to half of child sexual abuse is committed by another child. Anyone can be a victim, and anyone can be a perpetrator. Child sexual abuse happens in all zip codes, income brackets, cultural, ethnic, and racial demographics. Child sexual abuse is a crime of secrecy, and offenders often continue to offend because they don't believe they will be caught. In the case of children who offend, many don't understand that they are even causing harm. When we don't have open conversations about sexual abuse, we often aren't able to recognize abuse when it occurs, and children may not know that abuse is something they should disclose to a trusted adult. To deconstruct misperceptions and reconstruct an accurate understanding of child sexual abuse, CAC Texas will lead a statewide public health campaign. By spreading awareness, we will galvanize the public to prioritize child sexual abuse and understand their role in preventing it. One of the most impactful ways to build upon a public health campaign is to equip people with the tools to take action through prevention education. Texas is one of many states with legislation directing schools to address child sexual abuse through education for both adults and students. However, current prevention programs vary significantly in their effectiveness. The prevention education program developed by CAC Texas will address gaps in current programs and be available at no cost for Texas schools. In addition to curriculum for students, CAC Texas will create complementary programming for adult audiences as well, including caregivers, school employees, medical professionals, and leaders of youth-serving organizations. While we are only one of 50 states, focusing first on ending child sexual abuse in Texas will have implications for the rest of the country. Texas is home to the nation's second largest population of children. Improving outcomes for Texas will improve outcomes for children across the country. This shift may seem impossible, but 60 years ago, when nearly half of all adults smoked tobacco, it would have been hard to imagine a world in which smoking was not mainstream. Similarly, putting on your seatbelt is an automatic part of getting in a car. Behaviors, attitudes, and social awareness didn't change overnight, but with strategic public health prevention efforts, massive strides have been made and countless lives have been positively impacted. It has only taken one generation to achieve lasting social change related to smoking cessation and motor vehicle safety. We believe that a similar shift in the public perception of child sexual abuse prevention is not only possible, but necessary to create lasting social change, building a brighter future free from child sexual abuse.